Hi, welcome to our webinar here at Longwood Pediatrics. Today we're going to be talking about sleep. With me here I have Stephanie Joe, one of our nurse practitioners, and Dr. Kristie Koppenheffer, one of our pediatricians. So as we know, sleep can be a very challenging topic for our kiddos, and there's no one-size-fits-all approach, but figure we could answer some questions about some of these things today, and hopefully it's really helpful. One of the first topics that we're going to talk about is just some common concerns around sleep. What are the most common concerns around sleep that parents express to us? And Dr. Koppenheffer, do you want to start?
Sure. It's very age related. So I think we're going to focus more on the infants or younger children today.
Yes.
The number one question I get is, when should I start sleep training, or how should I sleep train? And I think there's many different approaches you can take in sleep training, but for most families, I encourage them to start sleep training from the very beginning. I think there's a little bit of a misconception that you have to wait till your baby's ready to sleep through the night before you start sleep training, where really you can start encouraging your baby to put themselves to sleep from the day they come home. Now, they may not be able to do it, but you're giving them that opportunity to do it. How do you think about it, Stephanie?
Yeah, I completely agree. Even during nap times or whatnot, maybe when they wake up, don't pick them up right away. Maybe just give them a few moments to themselves. So it can definitely start from the very beginning.
Also, when the baby is sleepy but awake, I encourage families to put the baby down and see whether they can do that last little bit on their own to go to sleep. And oftentimes when they can't, and that's okay. You can pick them up, and there's nothing wrong with doing that, but sort of giving them that opportunity. And depending on the temperament of the baby that you've been gifted, some will be able to do it more easily than others.
Yeah.
And if you have a particularly fussy baby, that's going to be harder.
Right. And I think some of the things that I've seen here in behavioral health is that a lot of parents kind of wonder, like, oh, am I doing this right? Am I doing this wrong? My child is sleeping through the night. My child is not sleeping through the night. I feel like a lot of them are pretty normal and kind of just part of this process too.
I find it's really normal. I mean, it can happen at any age, and or sometimes there's a few weeks where it goes well, and then we take a step back. So
there's a lot of disruptions that happen over time. Anytime your baby gets sick, or you go on vacation, sleep schedules are going to change, and that can disrupt sleep as well.
Speaking of which, do you guys kind of commonly see like an age range when it comes to changes in sleep behaviors or anything like that, or in your kiddos that you guys see?
I often find that, the biggest questions with infants, and I find that usually happens, I would say around the 4 months, there's usually a big regression there, but regressions can happen to any kids, or it may not happen to all kids, but 4 months, 6 months, 9 months, oftentimes when they transition, such as if they get some teeth or whatnot. This also can happen, with older kids or toddler age, preschool age, when they're going through transitions.
Whether it's regression or disruption, right? I try and tell families, if you have good sleep habits, when they get disrupted, you just have to kind of get back to your basics and kind of do that retraining. The sleep should come, but that there will be some bumps in the road. Nobody sleeps through the night every night.
Me neither.
Doesn't happen.
Not me.
Speaking of sleep training, so that's our next question. I would love to hear a bit more on your thoughts of what are the benefits of sleep training for parents and kids.
Right. So I think that's the key. When families come in, I think some families have maybe some guilt or some concern about sleep training because they want to get more sleep and they worry they're doing it for themselves. And I try and encourage families to think about it as being for the whole family, right? Parents parent better when they're better slept, but also children develop better when they're better slept. And so that sleep training is really important for your child's development. That I think is important to think about long term, because if we establish good sleep habits in infancy, then we can really set them up for success as they get older. Not that there won't be bumps, as we talked about, but just getting those good habits early is really important.
Yeah, absolutely.
Why is sleep training important to do earlier, and how early are we talking about? I know you touched base on this too, but
for infants around 4 months old or so, I do find it's better to start earlier, because when your infant or baby starts moving or walking over to you or climbing up onto you or knocking on your door, whichever it is, it can be a lot harder when they have those physical skills. And so it's just a lot harder on everybody.
Training them early helps because then they're set up to be successful when they're older. But also, once your baby can stand up in the crib and call your name, it's much harder to sleep train.
That part I feel like is always the hardest for any parent, right?
It's really hard. But I would also say, I think when families talk about sleep training, there's a little bit of confusion about what that really means, right? So you can sleep train your baby before they're ready to sleep through the night.
Yes.
And even if they wake at night, that doesn't mean they're not sleep trained, right? When I think about sleep training, I think about a baby who has the ability to put themselves to sleep. And sometimes they may still need to wake in the middle of the night to feed. you feed them and they can go right back to sleep. And then eventually they're able to go through the night. So for some babies, it's 4 months when they can go through the night. But for some breastfed infants, that's closer to 6 to 9 months before they're really able to go through the night. But that doesn't mean you can't sleep train them to go to sleep on their own at the start of the night or for naps.
That's a really great answer to that. So really, there's no one size fits all in this topic.
I think that's important for families to know. Not everybody's going to feel comfortable with the same approach to sleep training, right? When I meet with families, I sort of try and get a sense of what is their comfort level around letting their baby fuss, or how they want to approach it, and then that can shape our discussion. Sleep training doesn't have to involve a lot of crying, but sometimes it does. And if a family isn't comfortable with that, then it's not a good approach for them.
Right. And every child is different. Every sibling is different. So you can't compare.
When I see a lot of behavioral health, it says sometimes the babies have older siblings or younger siblings. And I think a lot of that comes into a factor of sleep training.
It's whatever feels right too. If you feel like it's ready to start, then it's probably the right time.
Trust your instincts, parents.
Yeah.
What would you say would be kind of the key differences if you're just trying to sleep train an infant versus a toddler? Just because I think around toddler age, they're still going to be going through some of those patches, right?
Which I'm going through a lot since I have a toddler. But oftentimes consistency is very important, whether it's infancy or with toddlers. The biggest thing is consistency, and having a good routine is very important. So sometimes there may be nights where, you were doing well with infancy and sleep training, and then it kind of backfires a little bit for whatever reason, whether it's a schedule change or routine change or developmental milestone that's happening in toddler years. And oftentimes you may get a step back, but just consistency, know your boundaries, and keep up with a consistent routine if you can.
I think that's the key, making it clear to them what the routine is and being loving but firm in that we do 2 books before bed. We don't do 10 books before bed, right? Because they learn the routine, but then try and extend that routine. And I think children who become overtired, they have a harder time falling asleep. So as much as we can get the kids to bed in the window that's right for their brain, it allows them to sleep better and actually sleep longer.
When I meet with a lot of parents, they always ask, oh, can we do 5 more minutes of this? Like, at what point do I say no? At what point do I keep saying yes, especially if they're having a hard day or something like that? But I think loving but firm is a really good approach to this.
We just have to be careful because these little guys are smart and they recognize that, like, oh, well, she did it last night, maybe she'll do it again tonight. And so I think the key is, you got to stick to the schedule as best you can. I mean, life happens, right?
But and to kind of remember that it's part of love that you're doing this as firm as you are, because I feel like there's a lot of guilt that comes with this, or there can be a lot of guilt that comes with this. And I feel like it's coming from a loving place, and that's really powerful.
100%. You're trying to get them to sleep so they can have a great day tomorrow.
Yes.
And you can spend time tomorrow. Yeah, that time can be special at night. The next day can be a disaster if they're overtired.
It's the greater good for everyone.
The greater good.
It really is.
Now, I think how would you guys categorize sleep regression versus sleep disruption?
I think it's a little bit semantics, but I prefer to use the term disruption because I think a lot of the things that happen at 4 months or 6 months, the child isn't really regressing. The child is going through a developmental milestone or family dynamics where the mother's gone back to work potentially.
That's a big one.
I think of that as like a change in the family schedule, and that can lead to a disruption, but that it's, normal for that family. It's just, we got to work through it. There are a lot of disruptions in life. And you start daycare, you get sick, and then all bets are off because then they're going to wake up in the night and you have to go to them because they're sick. And so it complicates the process.
Yeah. Or a sibling wakes up and wakes the other child up.
Yeah.
And it can happen, but just sticking through it. Sometimes it's a few nights of a rough night, but hopefully we'll get through that.
And it doesn't always mean a regression when they're having 1 or 2 bad nights.
Right. Exactly. Yes. I think of those as sort of blips, right? And when the child is sick, you have to go in. So that's a little bit confusing, especially to like a 9-month-old, right? Once they're well again and you get back to your routine, there may be some times when they wake and they want you to come. And that's when you sort of decide, like, I'm not going to go in. I'm going to let her put herself to sleep. And that may involve some crying if the family's comfortable with that. And I think for some families, it's reassuring to, if the baby is waking up at night, which is new, come in and let's check the ears. Let's make sure there's not a problem before you proceed with the sleep training, so that there's nothing that you're ignoring.
So not to panic if kids are going through a rough patch or the family's going through a rough patch. I feel like with consistency, it can go back to the way that they were if they were doing well, or you can get to that place where they're going to be a lot better at it.
Exactly.
Yeah.
Do both of you have any recommendations to help support parents going through this with their kids, or just any helpful suggestions at all?
I mean, there's definitely different apps that are out there now.
Yes.
One of my favorite is Huckleberry. You can just log the sleep and whatnot, and there actually are articles, and there's actually recommendations as to when your child should nap based on that schedule, or when your child should go to sleep, which has been very helpful. I know there are other sleep trackers, such as it's called Sleep Tracker.
That's an easy one.
Yeah, and there is a great online outline that you can find. It's called Taking Care of Babies, actually. Taking Care of, C-A-R-A, it's a person.
Oh,
She's
okay.
a sleep
That's
expert,
funny.
actually. But she actually outlines all different guidelines as to how you can help sleep train for all different ages, which is really helpful.
Oh, that's
It's been
great.
really helpful for me.
I have a book that I love that I always recommend to families, but again, it's not for everyone. Actually, I have a copy of it
Yes,
here
show us.
called Healthy Sleep Habits, Happy Child. And it's a little dense, is what I always tell families. There's a lot of information in here, but you can kind of skip to where your baby is. If you're you can skip to the 6-month chapter. Or if you're expecting a baby, it's a book that you might want to kind of look through ahead of time and then look back to as you go through the different phases. A lot of families also use the Ferber method, classic, solving your child's sleep problems. And that's also really good. Those are sort of two similar but different approaches. And I think for a lot of families, those are really helpful. But I think it's also helpful to have a conversation with your provider when you come in for, your well visit, or if you're having a sleep disruption or you're concerned you're having significant changes in sleep patterns, you can always schedule an interim visit to come in and do a further discussion about sleep. All the providers are happy to do that. Sometimes we even will refer families over to the sleep clinic at Children's, which really allows you to sort of dive in and do a very specific sleep training program for your child. And then there's also some online or private sleep specialists out there. But I don't know that everybody needs that, right? Like oftentimes you can have a conversation with your provider and sort of get started on a plan that will work for your family.
Exactly. Completely agree.
Do you feel like there's a specific time or concern that parents should make those follow-up appointments with you guys?
If it's been a few nights of rough night's sleep or, something also just feels, we're happy to take a look at them, make sure again, if there's any ear infection or any illnesses that we're missing, if they seem healthy, or really, I'd say max like a week or so if there's anything.
Yeah. That's a good guidance. I love that. And I think just today, the key message is just emphasizing really healthy habits, consistency. And it's not just for the child, not just for the parents, but it's really for the whole family and the benefits of just making sure that everybody feels okay and that everybody's healthy.
I think we can all agree it's not easy.
Not easy.
But, just stick to it, because it really is going to be good for everyone in the long term.
Thank you both for joining us. And thank you guys for watching.
Yes, thank you.
Thank you.